Welcome back to MovementProfessional.com. So today we're going to look at the 4 Ds of pressure therapy using a myo ball in the side of the abdomen. So oftentimes this will be thought of as a psoas release or a deep hip flexor release. I don't want to make the mistake of getting that specific with it because it's really just broad pressure and I'm moving it to the side of the abdomen instead of the central abdomen. But in front of me I have several different toys that you can use. I'm going to demonstrate with the myo ball today because that's the one that I tend to use most frequently, but we also have a trigger point grid ball. You could go, if you need to go a little bit smaller, you can go with the Yoga Tune-Up or Tune-Up Fitness Alpha Ball, which works well, especially if you have a smaller abdomen. And then if you want to be a little bit more aggressive, you go Mobility Wad Supernova. This is the original Supernova, not the 2.0, but you can go either way there. And then the So-Right would be the most aggressive, and you can actually grab a kettlebell handle too if you want to. I don't see a lot of need for that, but sometimes if you've been doing this for a while, the So-Right's nice because it can kind of get into some different corners around the pelvis that you wouldn't get with a ball, but harder and firmer is not necessarily better at all. So I think sometimes people just look for a badge of honor saying I could tolerate more pressure. After a certain point in time, it's not that necessary, but you have a lot of different options for what we're about to show here. So again, I'm going to show this with the myo ball. This is about 6 inches in diameter, which for my abdomen fits nicely for the amount of depth I'm looking to get from this. All right, so the 4 Ds, the first D would be to desensitize. So very important to be able to desensitize anytime you're going into the abdomen. And when we look to dissociate motion, and we're going to look to dissociate hip extension from lumbar extension, if you haven't desensitized to the pressure, you are not going to be able to get much out of the movement that you're trying to attain. So we need to first be able to desensitize and then deepen that pressure into the abdomen so that we can actually have a chance to block the motion that we're trying to block, which is going to be lumbar extension in this case. So we'll get on the ball here. I'm going to put it right, so if we think about the belly button being here, I'm putting the ball right next to the belly button, but I'm going to be above the belt line. So I got the ASIS, get up and kneel, I got the ASIS right here, that bony part, I got the belly button here. I'm going to be right in between there, and that's where I'm going to have the ball. I can move a little bit down, I can move a little bit up. I just want to make sure I'm below the ribs. So my ribs are right here. If I touch them there, so I want to make sure I'm below the ribs. And I want to make sure I'm above the pelvis. So this ASIS bony prominence is a good indicator for where the border is of the pelvis. So anywhere in there is fair game, and it's good to explore this. This is why I don't want to be too specific about what anatomy we're going about, because you may want to move it around and you'll find restriction in different places on one side versus the other. So I'm going to get onto that pressure. So I'll put it right on the skin. And I'm going to start in this, what I like to call a split prone position. So prone would be both of my legs are straight. I'm going to split the prone position by moving, in this case, my right leg out. So my left leg is in more extension, right leg is in relatively more flexion. That allows me to take a little bit more pressure to the left here. If I have both legs straight, what's going to happen is I'm going to tend to turn towards this right side. So I have that right leg propped out to move me a little bit more into the pressure. Start up on the elbows or on the forearms because it's actually a way for me to desensitize. This isn't as intense as when I go into a full prone position. Once I feel like I've desensitized here, I can take a few breaths in. Inhale moves the ball out of me. Exhale, ball sinks in. Now I'm going to test it out going fully prone, and I'm going to tend to look away from the ball. So I'm looking away from the ball here. Take another breath in, breath out, let the ball deepen, let it sink in. So once I'm here, then I can start to dissociate. So the dissociation is going to be squeeze the glute, and that starts the process of hip extension. And then I'm going to try to hover. So now I'm hovering my knee and my foot, they both come off the ground. Once I can get here, I can see if I can bend the knee without losing that knee hover. So if I hover and then I bend the knee and the knee goes right back down, I've done nothing. So I want to keep that hover, bend the knee, which adds a little hamstring activity, straighten it back out, drop it down, let the ball sink in a little deeper, and repeat. All right, I can enhance this a little bit by going overhead with the arms, do the same thing. So I'm reaching the arm and leg away from each other, bend. I can play around with rotation. So if I go heel more towards the shoulder versus heel more towards the middle of the spine, I'm going more internal rotation when it's heel to the shoulder. So
So I can explore that, and that's where most people are going to want to compensate by going into external rotation, which would be heel more towards the opposite shoulder or spine. So if I want to aim my heel towards the same side shoulder, I'm going to get a little bit more pure extension in the hip. All right, so that would be how I would go through the 4 Ds there. So first I want to desensitize. I start on my elbows and I go to prone, and then eventually I can go to prone overhead. And then I'm going, as that's happening, then the ball is deepening into the tissue. And then once it's deep enough, I can now dissociate motion. In this case, I'm trying to move my hip without really moving my spine into extension. And always the 4th D is just spend enough time there, because you need time to allow your body to relax into it. You need time for yourself to really explore the different corners of the abdomen, where the pressure is going there. So give yourself enough time so you get the effectiveness. Hopefully that makes sense. If you have any questions, you go to movementprofessional.com. I'll see you next time.